Hi, Ollie. How you doing?
I'm doing great, Annie. How about yourself?
I'm enjoying it. Thanks to the nice day here in Florida. Listen, Ollie, I was just thinking, we have a course coming up with Tufts University in June 6th and 7th, and it's kind of like a repeat of the course that we did back in the fall. And that was a big success, I think, for everyone, for the participants, for Tufts, for ourselves. So I think it might be helpful for future attendees if you and I could just discuss right now some of the topics we're going to cover and kind of the gist of the 2 days.
Yeah, exactly. So the course is going to be a repeat of the same course since that one was very popular. And that one consisted of the first day primarily didactic and theory, going over protocol, going over some of the biological basis of why we do what we do, and
Mhm.
so on. Kind of an endo one-on-one ideas of what endodontics is all about. And then the second day was primarily kind of doing hands-on, extracted teeth and models and so on, right?
Absolutely. And, the second day was exemplary because we were working with real teeth, and Tufts did an amazing job of supporting the course. But one thing that I thought that was a little bit different this time that I thought was really terrific was that in addition to the typical didactic and hands-on session, you were showing many cases. So it became like a case-based learning component of the 2 day course. I thought that was absolutely fabulous. And I think when you spoke to the attendees at the end of the course, they enjoyed it likewise.
Yeah, it is a combination of understanding the didactics, then seeing things done. And I had a microscope, so I was working a little bit under the microscope. People could see what's happening at higher magnification and illumination. You were right there, chair side, with them, showing how they could do it with the loops and lights instead of microscope. So I kind of it was comprehensive. You could get as much out of it as you really, want it.
What I thought was pedantic, and then there was a great song a number of years ago by Avicii, Levels, right? And that's what this whole course was about. There were different levels. And I think that's what really separates the course. So if you're at this level and you want to go higher, we've got a component for you. I'm also, as you know, very much driven by recent graduates of the dental schools who've had very little clinical experience. So I have a lot of patience with that and making sure that they understand how to do proper instrumentation and obturation.
Terrific. That's true. So, if you're interested in pushing your endodontic skills to the next level, or at least get a good comprehensive introduction and idea of what endodontics is and can do for you clinically, please join Dr. Akash and I June 6th and 7th at the Tufts CE program. And we look forward to having you.
Absolutely. We hope to see you there.
See you there.